Hello everyone, my name is McKenna Lindsay. My partners Sydney Bain, Savannah McCutcheon, Anna Robinson, and myself make up Autism Group 2. Today we are going to be discussing autism in clinical trials. So starting with a general overview of autism spectrum disorder, it is an umbrella term for a wide range of conditions primarily characterized by difficulties with communication and marked behaviors such as repetitions of words or behavior, social withdrawal, lack of interest in relationships, and in some cases, speech impairment. The Center for Disease Control and Prevention estimate 1 in 59 children fit the criteria for autism spectrum disorder. It is 4 times more common in boys than girls. There are no known causes, and research suggests that genetic factors play a role in the development of the condition. It usually appears before the age of 3, and the rate is steadily growing. So the purpose of clinical trials is to test interventions such as new medical devices, lifestyle changes, or medications that are used to determine if the intervention technique is safe and effective for the specific target population. So there are 4 phases of clinical trials, and at any point you can withdraw from the trials, and participation is completely voluntary. So at the first phase, or actually at phase 0, scientists are learning how the medication works, and they recruit 10 to 15 individuals, test the medication, and then determine if the drug is safe. Phase 1, they determine how the drug works in the body for an extended period of time, and they use healthy individuals, so in a group larger than 10 to 15 people. In phase 2, after the medication is deemed safe in phase 1, it is then tested in the target populations, and researchers will begin to look for individuals with autism spectrum disorder to apply the intervention technique to them. In phase 3, they recruit 3,000 or more individuals that are using a common standard intervention, and they compare it to the new intervention technique. For example, if they are developing a new type of headache medicine that is called ABC, they need to compare current standard, which would be ibuprofen, to the new standard of ABC to determine if the new standard is an effective, safe, and accessible as the current standard. Then in the final phase, phase 4 is an ongoing phase. It occurs after the drug is approved and available to the general population. After treatment is released, researchers continue to gather info about safety and effectiveness of intervention. Specifically in clinical trials in autism, no drugs or interventions are available that effectively treat or cure autism spectrum disorder. Intervention, however, is constantly being sought after to help individuals with autism as well as their caregivers and loved ones. Sydney is going to discuss the current trials that are available regarding autism spectrum disorder intervention.
Hi everyone, my name is Sydney Baines, and I am going to be discussing some current clinical trials. The first clinical trial is taking place at the National Taiwan University Hospital, and it is titled Establishment of Social Skills Training Group in Adults with ASD and Effective Analysis. The purpose is to examine effectiveness of social skill training groups in adults with ASD. The intervention is behavioral. The PEERS provides evidence-based social skills treatment in preschoolers, adolescents, and young adults with ASD. The PEERS is the program for the educational and enrichment of relational skills. There are currently 160 participants. It started on March 8, 2017, and the estimated completion date is July 1st, 2023. Continuing with that clinical trial, the control group is not receiving PEERS behavioral intervention. The experimental group is receiving PEERS behavioral intervention. The eligibility requirements: you have to be ages 18 to 45, all sexes are included, you have to have relational problems, motivation to participate, good Chinese speaking, healthy caregiver joints, IQ of over 70, and autism spectrum quotient of over 26. The exclusion criteria includes psychosis and neurological disease, and visual and/or hearing impairment. Our next clinical trial is titled Safety of Cultured Allogenic Adult Umbilical Cord Derived Mesenchymal Stem Cell Intravenous Infusion for Autism. The definitions of mesenchymal stem cell is multipotent adult stem cells that are present in multiple tissues like umbilical cord, bone marrow, and fat tissue. An intravenous infusion is commonly known as IV and is a method of putting fluids into the bloodstream. The start date of this clinical trial was September 2021, and the estimated completion date is September 2025. Continuing with this clinical trial, the purpose of the study is safety and efficacy of intravenous infusion of cultured allogenic adult umbilical cord derived mesenchymal stem cells to treat autism. The intervention is biological, and AlloRx is a cultured allogenic adult umbilical cord derived mesenchymal stem cell. There are currently 15 participants. The experimental group includes individuals with autism who will receive one intravenous infusion of 100 million cells, evaluated 1 month pre-treatment, and 1, 6, 12, 24, 36, and 48 months post-treatment. The eligibility requirements for this clinical trial is a diagnosis of autism, and all ages and sexes are included. Exclusion criteria includes active infection, active cancer, chronic multisystem organ failure, pregnancy, clinically significant abnormalities on pre-treatment laboratory evaluation, medical condition that would, based on the opinion of the investigator, compromise the patient's safety, previous organ transplant, seizure disorder, and hypersensitivity to sulfur. Now Savannah is going to discuss clinical trials that have been conducted in the past.
Now that we've looked at current studies, let's look at the past clinical trials. Provenzeti and colleagues did a systematic review of 406 past clinical trials. The target of their study was to see what past clinical trials were targeting when they treat autism spectrum disorder. The selection criteria for this review searched the Web of Knowledge database in between 1980 and 2016 to identify control trials that investigate the efficiency of intervention. Studies meeting the following criteria were included: original articles published in peer-reviewed scientific journals written in English, included subjects with pervasive developmental disorder or autism spectrum disorder diagnosis, randomized control of trials or observational longitudinal studies comparing at least 2 different interventions directed to people with ASD or one treatment versus placebo, and lastly, studies which reported clinical outcome. Of these trials, 406 were chosen and a total of 327 outcome measures were identified. Trends in outcome assessment strategies were analyzed to identify the most used instruments. For this study, that included greater than 5% of the studies following criteria were included. The results of this systematic review found that a total of 475 tools were used across the 406 trials to assess clinical outcomes. Of these tools, 247 were validated, 53 were at least previously cited in literature, and 148 were ad hoc measures. Only 8 validated tools were used for the outcome assessment in more than 5% of the studies, and the only tools used for core symptoms were the Social Responsiveness Scale, Childhood Autism Rating Scale, Autism Diagnostic Observation Schedule, and none of these tools have been specifically designed for outcome evaluations. They found that the most common way to test problem behaviors was using the Aberrant Behavior Checklist and the Conners Rating Scale. In the pharmacology trials reviewed, the ABC was the most used tool. Following this, the CGI and the CGS were also very common. Some takeaways from this review is the lack of consistency in ASD outcome evaluation. A key finding of this is the complexity of assessing outcome in ASD and the difficulties in reaching a consensus in the scientific community. This finding may explain the inconsistent conclusions obtained by research in ASD until now. Another issue with these trials is that the target aim was not specific. Almost 1/3 of interventions did not target a clear symptom domain or targeted multiple and vaguely defined domains. Also, the scales most frequently used for evaluating changes from interventions targeted targeting core symptoms were originally developed to assess core symptoms and were designed as a diagnostic tool and not for evaluating outcomes. Lastly, core symptoms are not the only important target for individuals with autism and their families. Only 7 trials of the 406 included measures evaluating quality of life, and only 3 studies had quality of life as their primary aim. In conclusion, outcome measures remain highly heterogeneous, making synthesis and generalization a challenge. This is something to take into consideration and to think about for future clinical trials, including individuals with autism.
How the autism community views clinical trials. In 2014, researchers completed an interview study that was comprised of over 1,500 questions. They interviewed researchers, people in the autism community, and clinicians. Results showed from the questionnaire that researchers perceived themselves in good standing with the autism community. Some researchers were concerned with actually involving the autism community in decisions about research because it might not be, quote, appropriate for them to decide what and how issues should be researched, and it might politicize scientific issues. Other researchers felt it might be a good idea to encourage relevant stakeholders to consult with scientists. Researchers also showed concerns with involving the community based on the fact that those within might have disputing ideals that couldn't be resolved and would only lead to negativity. Some researchers felt that there were potential benefits of including the community, such as increasing awareness of the research process, which would in turn better translate into practice. A majority of the autism community wanted to be more involved in research. They felt the research community should be utilizing the autism community. Other community members with previous experience with involvement stated they never received any finalized results. They felt like researchers didn't value their input, saying, "They only want us as guinea pigs. That's the only contact they want with us." Parents suggested that research was indigestible and full of too much scientific jargon. They said this contributes through the disconnect between the two communities. Parents felt jaded and cynical about the, quote, pointless research that isn't actually concerned with everyday experiences with autism. Parents also said they needed more clear-cut research that actually answers their questions with certainty rather than suggestions, ifs, and maybes. Practitioners were also interviewed and shared more positive feelings about building links with researchers and highlighted important links between the research community and their schools and clinics. They claimed to understand the importance of finding relevant truths about autism and that it could be useful in practice. In a 2021 study, there was a focus on a lack of inclusion of girls and women in autism research and clinical trials. Girls and women are understudied and are in turn excluded from the benefits of research. Sex of a child has held influence over parents' attitude toward genetic research in significant ways. Though researchers use exclusion criteria such as sex to keep homogeneous samples, generalizability suffers. The autism community blames this lack of inclusion for camouflaging, which is where people with disabilities, in this case ASD, mask their social difficulties by hiding socially unacceptable behavior or acting out socially valued behaviors, essentially pretending to be neurotypical. This exclusion could also cause harm and/or discomfort to those who are part of a non-binary community as well. This demonstrates a lack of respect for persons and an injustice in terms of lack of representation. Those who are part of the autism community want intersectionality and greater inclusion. The FDA held a meeting with stakeholders in the autism community and researchers. They realized the first step was to listen to the voices of the community. The community expressed the need for perspective and urgency. Parents and self-advocates emphasized the need for psychoactive medicines that have fewer and milder side effects, and medicines that increase function in the areas most critical in day-to-day life, such as communication and cognitive skills. The point of this meeting was to be able to give researchers guidance on designing clinical trials to achieve what matters most to those who matter most. This leads to improvement of co-occurring health conditions rather than solely focusing on ASD's core symptoms. They hope the meeting will encourage a new way of approaching clinical studies and gather funding agencies and researchers who truly care about the community. Ethical considerations of clinical trials and ASD. 75 of 120 countries that ASD has been identified in are low or middle income. However,
Funding is in place for global research, and we know this kind of study is necessary. There are special considerations to be made in the case of research in these countries where much research has been done. In some lower income countries, such as India, confidentiality is far more important than it is in the States. In these countries, marriability is important, as arranged marriages are what grants a family their status. If others find out about a genetic disorder, disability, or mental illness, the negotiation process for the marriage becomes overly complex and sometimes even impossible. Confidentiality is critical in avoiding stigmatization and discrimination in the communities among these countries. The families in these countries have less access to internet and education, which makes it difficult for researchers and clinicians to even explain what is happening with their children and their disabilities. Researchers in this area of the world have to go farther than just gaining informed consent. They must present information to these families and make sure it's clearly understood, as well as fully disclosing the limitations of what is currently known about ASD. In terms of epidemiological research, the autism community is concerned on whether the identification of persons with ASD could cause harm to them or their families. In lower income countries, unlike the US, a diagnosis does not ensure services, it reduces the availability of them. Another problem with epidemiological research in other countries is the reliability of testing and screening measures. The MCHAT, for example, has been translated into more than 40 languages, but has demonstrated low specificity in some of those translations. There's a lack of cultural relevance that is equally as alarming. Another issue noted by the autism community specifically is that the research focuses on screening, testing, diagnosis, medicine, etc., but then fails to actually provide the intervention. In closing, there is a fear these families are being exploited of their time and well-being without the proper services to follow. The ASD community would feel better about clinical trials in sites across the world if the research community were to collaborate with health policymakers to ensure that community outreach is a part of the research.